The project, Introduction of Mobile Health Technology at the Primary Healthcare and Community Level in Mongolia, began implementation in January of 2016 and was successfully completed in February of 2017. It was funded by the Korean Foundation of International Healthcare and the Community Chest of Korea and supported technically by the World Health Organization, Ministry of Health, and local governments. The goal of the project was to strengthen the capacity of primary healthcare services through especially improving health of the disadvantaged and marginalized populations.
And as we all know, this pilot that we are doing in Amrogobi and Songhana Hokan, where we are screening everyone above the age of 40, communicable disease of hepatitis B, C, syphilis, also non-communicable disease, blood cholesterol, blood sugar, as well as doing abdominal ultrasound, single-strand ECG, blood pressure measurement. So the support of COFI and CCK is not only showing a good practice example, it will lead the way for the Mongolian government and people to achieve universal screening for everyone for both communicable and non-communicable disease. So finally, I want to again express our thanks to COFI and CCK. Thank you very much.
Early screening will go much further if we use mobile technology to reach our local registered residents for health screening. In the Millennium Development Goals, we're aiming to increase our life expectancy to the age of 78 years by 2030. That's why it's such an important project to help us reach this goal.
Namgong Som of Umungobi Aimak is the most southern point of Mongolia. It is located 710 kilometers from Ulaanbaatar city. September 7, 2016. Although it is mid-fall, the weather is warm in the Gobi just like summer days. The farming grounds of Virtanbolgang is located 30 kilometers from the Sum center and it has an artificial pond and watering system. The residents of the Sum do minor farming in their own allocated lands. One of them is Tatsral. She started farming with nettles, fennel, and millet in 1989. Now she has expanded to farming 12 different types of vegetables in the rich Gobi soil. She uses manure from her livestock as fertilizer. Tatsral keeps an ear out for any information on healthcare services as she had worked in the healthcare industry for over 10 years. Hence, she was one of the first persons to be screened within the mobile health project. The doctors are conducting a comprehensive screening in all the bugs. I am very happy. It is difficult for them to conduct screenings regularly because they may not have enough time or supply of medical equipment. The countryside is countryside. Now, the residents of our Sum are getting screened and receiving the healthcare services that they need fast. I think this project will have a good outcome. Tatsral has trained 10 students in farming at the Sum Center. One of her pride is the blossomed elm, aspen, and tamarisk trees she had planted 10 years ago. It was an eye-opener for those who thought that the Gobi is just sand dunes. The mountainous rocks look like art sculptures. The apricots and cherry blossoms are the ornaments of the Gobi. This is Dr. Otonchimik of Namgong Sum Health Center. This is Batirtan. He looks over the domestic industry of the Sum. Today, he is in charge of driving the Sum Health Center's vehicle. They both know all the locations of the Sum's herder families and their farms. The Sum Health Center's vehicle broke down on the way to Dirsenosbag, but the vehicle was fixed and they reached their destination at Bayırcargals. The family head, Bayırcargal Norov, built an extra gear for the mobile health screening. Families from Dirsenosbag came to be tested and everyone involved was busy. Bayırcargal's gallbladder and both his kidneys were found to be inflamed. His wife, Odgirl's both kidneys were also inflamed. They both will have to see a specialist and receive treatment. They work tirelessly on their livestock from dusk till dawn. They gather their horses, water the sheep, prepare dung and wood for fire, strap the colts, milk the camels and goats, and milk the mares every 2 hours. There's always work to do.
I got screened and received health advice, but it's difficult to follow through with the advice. I want to make some changes. We work hard, and it might take a lot of time to implement the changes, starting with financial challenges. We would have to take a long journey. Our life in the countryside is not easy.
Bayer Jargal is busy with campaign work on top of his duties as Bug Governor. He travels around and conducts surveys on mobile residents and their winter preparations. He then analyzes the data and holds quarterly meetings with the Bug residents to discuss current challenges and solutions.
Mobile technologies is taking many devices from the hospital to the patient. The patient does not come to the hospital. The healthcare worker goes to the patient. We are interested in treating communicable and non-communicable diseases, diagnosing and treating, so that the most important point is that you don't just live a long life, but you live a long and healthy life.
December 23, 2016, midwinter. It is midwinter and the coldest days are here, but it is warm like fall days in the Gobi. We ran into Bayer Jargal on his third visit to the Sum Health Center since he was tested within the Mobile Health Project.
With the help of the mobile health screening, I was able to be diagnosed early. I'm receiving treatment now. I have my family to take care of. I realised the healthy diet is important and that I should take care of my health. I got retested and I just got my results back this morning. I'm healthy and I've recovered. I'm very grateful to my doctors.
There are 20 health workers at the Nomgong Sum Health Center. A total of 1,521 people from the target population were screened during the Mobile Health Project. One of them was Bayer Jargal. You have applied the advice on healthy lifestyle well. You took your medications regularly. As a result, there are no abnormalities in your recent testing. There are no more complaints. You are healthy now. Congratulations to you. Please continue to follow my advice. Bayer Jargal leaves the Sum Health Center happy. He now knows that the greatest wealth is health. He is worried for his wife who stayed back at home, but he walks a little lighter since he will be stepping down from his duty of Bug Governor. Bayer Jargal's family is spending winter at Huchzeg, located 80 kilometers from the Sum Center. He leaves for home with the doctors of the Sum Health Center in the new UAZ Patriot Jeep provided by the Mobile Health Project. Although he has a large family of 10, he lives with his wife and son. They look after their livestock of over 600 sheep and goats. He asks his son or neighbor to look after his livestock when he needs to visit the Sum Center.
It was expected to get severely cold in the winter of the year of the monkey, but it has been relatively warm and gentle with little snowfall. The livestock are well fed and the people are healthy.
Looking at your ultrasound, your liver is fine. Your bile consistency was irregular before, but it looks fine now. Your pancreas and spleen look fine. Your kidneys had minor inflammation previously, but it looks okay now. Your ultrasound results are better compared to your initial results. I understand now that you need to eat healthy and practice healthy behavior in order to stay healthy. It is important to get screened to remain healthy. Mobile health screening equipment is essential for people like us who live in remote areas. As advised by my doctor, I reduced my fat and salt intake. Now we mainly eat soup and dairy products. The prescribed treatment and Odgaril's perseverance has proven effective. Odgaril and her doctor are both pleased. It's the doctor's happiness when her patients are healthy. Mandlai Som of Women Gobi Aimak is 224 kilometers from the Aimak Center. There are 19 health workers at the Sum Health Center. Essential primary health care and preventive services were delivered to residents of the Sum with the implementation of the Mobile Health Project. A total of 2,183 people were screened, including people who live in remote areas and those who don't seek health care. The doctors were able to create health information base of all the residents at the Sum Health Center.
The provision of mobile screening equipment and rapid diagnostic tests to our health SOM centres supply was a tremendous help in delivering essential primary healthcare services to the residents of our SOM. By providing mobile screening equipment to the physicians in other SOMs, I believe we can improve the primary healthcare services and strengthen our health sector at the AMEG level.
Батар Purvayush of Uihibag, Mandlesum. He lives with his wife Enktuya and his son, who is a year and 7 months old. They moved from Hoft Aimag to Umungobi Aimag 3 years ago. He had his viral hepatitis C activation tested. How did you feel about the mobile screening? The health workers were friendly. I am glad they detected this disease on its early stage. Have you started your medication on hepatitis C infection? Are you taking it on schedule as recommended? Are you adhering to the dietary advice? I have eliminated fatty foods from my diet. I have also stopped drinking soda and alcoholic beverages. You will need to start doing physical activity that is right for you. Turbat Khorga of Ugomurbag, Mandlesum. He lives with his wife, Bat Toktokh. All of his kids have moved out. He moved to Mandlesum from Toktovasum. During the mobile health screening, he was diagnosed with gallbladder stones. His diagnosis was confirmed at the Aimag General Hospital. It has been a month since he underwent surgery to remove the gallbladder stones. You have to maintain your diet for an extended period of time. You have to come for a follow-up testing every 3 months and take your liver medications. Has your wound healed? There are no inflammation or liquid at the wound. That's good. I was able to get treatment for my gallbladder stones by receiving mobile health services. I wouldn't have known that I had gallbladder stones if the doctors did not provide mobile screening. The doctors are effectively reaching the residents and remote herders of our SOM. Gorvantis SOM Umungobi Aimag. Gorvantis SOM is the most western region of Umungobi Aimag, located 350 kilometers from the Aimag center. It is the SOM with the largest territory. There are 22 health workers at the SOM Health Center. A total of 3,101 people were health screened within the project. The SOM has a high number of mobile population due to mining. The mobile families were happy that they were receiving hassle-free healthcare services. We conducted home visits, provided comprehensive health screening, prescribed treatments to those who are sick, referred patients to higher-level hospitals, and provided health education and promotion. The residents are very pleased. Many people who are unable to receive healthcare services were able to get tested with 6 different types of rapid diagnostic tests and 4 different types of medical equipment, all at the convenience of being home. During mobile screenings, many cases of cancer and hepatitis B and C were diagnosed. Many of these patients went for treatment and they are recovering now. The residents of Nomgong, Mandlay and Gorontis SOMs are grateful to the funders and supporters who made mobile health services possible. Just as the weather is warm, the hearts of the people are also warmed. They are all very happy. 7th Horo, Sungun Herkhang District. This Horo has the 2nd highest population as of the end of 2016. There are 22 health workers at the 7th Horo Inhingurgo Family Health Center. They screened 3,810 people for the mobile health project. 7th Horo is remote from the city center and has many families that live below the poverty level, unregistered and unemployed residents. Batnasang Rekzitma is a resident of 7th Horo. He is 80 years old. He currently lives with his wife. During mobile health screening at his house, his right kidney was found to have abnormalities. He was referred to the district health center and later to the National First Hospital where he was diagnosed with cancer in his right kidney.
I never had any pain or complaints, but the doctors told me I had cancer in my right kidney and I needed surgery. I underwent surgery to remove my right kidney. I'm recovering now and I want to say thank you to my doctors. They were very kind and nice to me.
Many people who are tested with abnormalities are referred to higher-level hospitals. We are working closely with our colleagues at higher-level hospitals in treating and managing our patients. We had patients with many sickness and they are currently receiving treatment. We also had a patient with cancer and another patient with gallbladder stones. The cancer patient underwent surgery and is recovering well. The other patient is expected to undergo surgery in April of 2017. This project is effective and the results are good so far. 26th Horo, Sungun Herkhang District. This Horo has the 3rd highest population as of the end of 2016. There are 21 health workers at the Ikhumbosok Family Health Center. They provided mobile health screenings to 3,516 people within the project. 26th Hara has many unregistered and mobile families. The project targeted to screen for blood glucose, cholesterol, and hepatitis B/C among adults over 40 years and HIV and syphilis among 18 to 35-year-old adults. However, every adult was eager to be screened with the ultrasonography and electrocardiogram. We were provided with ultrasonography, ECG, and different types of rapid diagnostic tests, as well as training on how to use these medical equipment. One of our physicians, who is specialized in ultrasonography, was responsible for conducting the ultrasound, while the other physicians did the mobile health screening. It was important that only one person handled the ultrasound, as she was the most experienced, and we also tried to save time. Our residents were pleased with the mobile health screening. Naran Titik, 59, is a temporary resident who is a native of Bayonghongor Aimag. She was health screened on 20th of July 2015 within the mobile health project while she was visiting her daughter. She was referred to a higher level hospital where her diagnosis of liver cancer was confirmed. She is now receiving treatment and management at the National Cancer Center of Mongolia. I am visiting my daughter who lives in 26th Hara, and I have been fortunate enough to be screened. I am currently receiving treatment and it is going well. My mother has never been health screened before. She had been coughing for several days. My brother asked Dr. Sovda if he could have his parents get screened who are temporarily residing in the Hara. We are very pleased that my mother was screened and diagnosed early so that her cancer wouldn't spread to other parts of her body. The health workers of the family and some health centers are working on data analysis and drawing conclusions. The paper forms that were used previously have been converted to the VHS application. Visiting Home Service or the VHS application has been developed for use in cell phone, tablet, and in web-based formats. Also, Project Operational Guideline, Handbook on Training Material Compilation, Data Management Handbook, and 11 different types of IEC materials were developed and published. These materials can be used for future similar projects, and this has become a major investment.
As a COICA advisor, I'm trying to bring in new information technology to Mongolia. VHS, a visiting home service, is very effective in Korea, especially for the residents living in very remote area, such as a deep mountain or island country, so that they have a difficulty of access to health care. So a group of visiting home service team consists of doctors and nurses, bring their equipment and notebook to patient home to provide care. I think VHS service is even more important to Mongolia because Mongolia is such a big country, so that we'll like to have this VHS team with doctors and nurses bring their smartphone or notebook and mobile devices to patient home to provide care. So mobile devices include portable ultrasound, portable ECG, and portable blood pressure management.
The data that has been collected from the mobile screenings is large. Using this data, we can draw valuable inferences for the prevention of communicable and non-communicable diseases. Recommendations can be drawn at the IMUG, regional, local, and national level that could impact current policies, resource mobilization, as well as reduce unnecessary expenses. At the completion of every job, we determine if the goals and objectives have been met. A total of 14,242 people were health screened within the mobile health project. Every party who was involved in the implementation of the project, introduction of mobile health technology at the primary healthcare and community level in Mongolia are pleased. This is because the results can be seen in the community who benefited the most.